Prevention and treatment of COPD, chronic obstructive pulmonary diseases. First step, which is vital and which is very necessary, is the quitting of the smoking altogether. Absolutely finishing of this habit worldwide is essential to avoid the or to diminish the COPDs in the human society or the human race. For that, the provision of the sanitation, that is the to avoid the or to mitigate the air pollution, have a noise living and the fair environment and atmosphere where there is no fume, dust or other air pollution which are inhaled and produces the production of such chronic diseases of the lungs. So sanitary measures is compulsory. So there is clean and neat atmosphere. Moreover, drinking of plenty of purified water and also healthy diet, that is which consists of high quality protein, fat and carb diet consisting of sufficient and the necessary minerals and the vitamins which are necessary for daily use of the human health. Fresh veggies, fruits, and the diet should be very clean and of according to the standard of the human health. Moreover, the preventive or prophylactic measures are necessary because there are complications of COPD, that is, these diseases may produce frequent attacks of influenza flu, pneumonia, and may cause in the long run, that is the carcinoma of the lungs. So, immunization and vaccination, annual vaccination is necessary for influenza, flu, and pneumonia. So these are the major preventive measures that you should be vaccinated regularly, annually, have a good diet, your atmosphere, living area must be clean and neat, and have a abundant quality of the purified water intake. Now to avoid the stress and depression, you should adopt healthy and good hobbies, society, activities that you should reduce your depression by the yoga exercises and meditations. So the psychological factor is the main factor in causation and the etiology of the major somatic diseases of the human being. So to avoid these stress, depression, anxiety, fear, it is very compulsory for creation of a happy society. Now the treatment of the COPD, as there is reduced elasticity of the alveolar tissues, they become inelastic, they are distended and form bully formation, which is useless and occupying the major portion of the thoracic cavity. So that produces pressure over the healthy tissue of the lungs and also reduces the function of the healthy lung tissue remaining. So we have to remove, that is by the process of bullectomy, that the bully formation that is excised and removed so that the healthy tissue of the lungs, they can expand and can perform their normal duty of the inspiration and exhalation. So this is a basic surgical procedure. Now the disease portion, the other disease portion surrounding, in addition to the bully formation, they are also excised by the section of the that damaged tissue so that the normal tissue can expand and can also perform the function of the respiration. In addition, there is transplantation of the lung. If donor is available, so surgeon can perform the lung transplantation, single lung transplantation. It is a very complicated, not complicated, very, very intricate and very expert surgeon can perform this major surgery to remove the diseased lung and replace the donor healthy lung in the COPD patient. Now the medical treatment, there are three ways of treatment: oral treatment, nebulizing, and inhalation in the form of inhalers. These are available in the medical field. Short-acting bronchodilator, long-acting bronchodilator, and the corticosteroid, that is steroid therapy, is formed in combination in the form of oral, nebulizer, and the inhaler form. These are available in the market and can be held from the medical store under prescription of the qualified and certified medical practitioners. So these medicines, they are used to dilate the airways so that mucus is expelled, airways is patent, so that there is no obstruction in the expiration, exhalation, and the inspiration. Mostly in these patients, there is difficulty in exhalation. That is, the air is entrapped in the air sacs, which causes the damage to the elasticity and functioning of the air sacs. They are expanded and they cannot extract the oxygen from the fresh air and cannot expel the carbon dioxide outside the body. So this is the main pathogenesis by which there is the lung functioning is hardened and that produces the misery and difficulty in respiration to the patients. So healthy diet, healthy atmosphere, proper treatment by the bronchodilators, corticosteroid. But one thing is to be remembered, that beta blockers should not be advised to the person suffering from COPD. Moreover, corticosteroid should not be given more than 1 week in oral form because it produces hypertension, increases diabetes, produces edema, and also it also reduces the capacity of the power of the immune system of the patient or the person. So it is an emergency treatment which should be for short duration. Short acting and the long acting bronchodilators, they are used in combination form, in oral form, in inhalers or in nebulizers. All these way of treatment that is meant for dilatation of the airways and also to expulsion of the mucus which is formed by the irritation of the mucus secreting glands to clear the passage of the air inside the lungs and outside the lungs. So these are the basic factors for the treatment of the COPD.